All right, all right, all right. Good evening. Good evening, good evening, good evening. How are you doing today and where are you connected from? Good evening. I see someone has connected already. Good evening. Nice to have you on board. I would love to get to know you. So kindly comment where you're connected from and your name. Good evening. Welcome to El Talk with Kemi. Welcome on board. It's so nice to have you. And tonight is going to be so amazing because tonight Nos Oyedeji is bringing the fact about fibroids. Fibroids is a very controversial reproductive issue topic, and I believe that every woman should be aware of this because knowledge is power. And unless and until you're aware about a particular thing, you can't or you do not know what to do about it if it happens. And it's not a deadly disease. It's not like anyone that has fibroid will just automatically not exist again. And that's why knowing what fibroid is, knowing the signs and symptoms, knowing the treatment options is very, very important as well as a woman. So welcome on board. So nice to have you here tonight. Kindly type out your name and where you are connected from. We'd love to meet you. We'd love to meet, even if we can't see ourselves one-on-one, right? We'd love to connect with you online, on this online space. So kindly type out your name and where you are connected from before I bring up Nos Oyedeji to give us all that she has prepared a lot for us tonight. She has prepared a lot, a lot, a lot, a lot. So let's get to know you. I still don't see the comments coming in. As in my network. We love to get to know you. Love to get to know you and where you're connected from. So please, please, please. All right, welcome to El Talk with Kemi. El Talk with Kemi is a global platform that is dedicated to raising health awareness and empowering both male and female about their health so that they can make informed decisions about their health as well. And you can check the page for amazing health updates. We've had a lot of videos, I think over 115 videos right now, and you can just go through the page and just catch up with many of the videos. The month of September was for PCOS and for sickle cell awareness. So I made a video about PCOS and sickle cell. So you can also check my page to see more about this and be informed and be well, be well knowledgeable about these topics. Thank you once again for joining in tonight. And if it's your first time joining in, do not forget to subscribe. Oh yeah, do that now. Hit the subscription button below, the red button below, and subscribe and be a part of the family. Thank you so much. I'm watching. I hope that you've subscribed. If this is your first time joining in, please do well to subscribe. We'd love it to be a part of the family. Please do well to subscribe. It is your first time joining in. So, in no further ado, I think I have to bring up Nosoyedeji now. She's ready for us. I can see her backstage. She looks beautiful. I can see her backstage looking all beautiful, looking all beautiful, all beautiful. And I just want to bring her up right now. I want to bring her up right now. Nosoyedeji, can you give me a sign if you are ready? I think I saw you earlier. Okay, I saw her backstage earlier. But I think the network took her out. All right, while we wait for Nosoididi to come back on board, can we please get to meet you? Can you type out your name and where you are connected from tonight? Your name and where you are connected from tonight. Thank you so much. Your name and where you are connected from tonight. We'd love to meet you. Okay, there's gifts for anyone that tells us the name and where they are connected from. All right, I see you now. I see you. Okay. I see Precious. Precious from Uyo. Wow. Well, welcome, Precious. Nice to have you here. Welcome, Precious. Nice to have you here. I see IBK from Lagos. IBK from Lagos. Nice to have you here. Thank you so much. Thank you for being here. I think okay. I see Christian. My name is Christian, and I'm going from Port Harcourt. Tonight is interstate connection. Nice to have you on board, Christian. I see Nosbada King. Good evening, Nosbada King. How are you doing today? I see Akindele Olulola Lola from Wolverhampton. I know this one is not just in Nigeria, in Nigeria state. Nice to have you on board, Lola. Thank you for joining in. I see Fumi Lola from Abuja. Thank you. I'm seeing new people tonight. Even if you can't see one on one, I'm connecting with you and I'm so excited. Thank you for being here. Thank you for joining. God bless you. And I see Nos Oyedeji at the background, at the back end. I see her. I think she's smiling already. I think she has had her people's name because I can see her smiling. And without further ado, I'd love to bring her up. While I am not so Oyedeji, are you ready? Can you wave your hand to let me know that you are ready? Looks like the network is fluctuating. But can you let me know if you are ready, Nurse Oyedeji? Can you wave so I can know that you are ready? And please, if you've not subscribed, please subscribe to the YouTube channel. Subscribe to the YouTube channel. Oh my God, network is acting up tonight. We speak to the network. Nurse Oyedeji, can you hear me? Amazing. Amazing. And network just took her out again. Just now. She was at the back end earlier. Okay. She will be back soon, please. She'll be back soon. I think her network is just fluctuating. She'll be back soon. Please do not leave. Do not go anywhere. Nurse Edeji will be back very, very soon to discuss fibroids with us. It's just a network that is acting up right now. Okay. Okay, so while we wait for her to come up, how was your day? Trust your day went well. How was your day? How have you been? And happy new month in advance. It's a new month tomorrow. The new month starts tomorrow, and I'm super excited. Like it is the 10th month in the year 2025, and God has been so faithful. We have 2 months to round up the year. So happy new month in advance to everyone listening to me. And if you're already in the new month already, wherever you are, happy new month to you. Happy new month to you. And tonight session on fibroids, like I said, is going to be so enlightening because I believe that every female should know about fibroid and should be aware of the signs and symptoms as well. So perhaps, do you have anyone that has experienced fibroid? Do you know anyone that has fibroid, that has experienced fibroid? Hi, hello. Hello, winners from Lagos. Hi, winners. Nice to have you on board. Thank you for joining. Good evening. Happy New Month in advance to you. Omolola Fakayode. Happy New Month in advance to you. Please ensure that you subscribe to this channel. Hit the red button below to subscribe if you've not subscribed yet. While we are waiting or a day to come up on board, our network is just amazing. She was here at the back end since I don't know what is going on, but I believe that she will be up soon. Yes, and I see that. She will be up soon, please. I see Silva from Ilorin. Nice to have you on board. Good evening. Good evening. Thank you for joining in. Thank you so much. Good evening. Don't forget to subscribe to the YouTube channel. I think she's back now. Don't forget to subscribe to the YouTube channel. Thank you so much. I think Nurse Adeji is back now. Yeah, she's back now. So let me just go ahead to read her profile. Oyede Jeniola Esther is a graduate of Madonna University, River State, Nigeria, where she obtained a bachelor's degree in nursing alongside other professional qualifications. She is a dedicated health writer and freelancer, specializing in academic research, in project and written content development within the health and wellness field. Her areas of passion include mental health, nutrition, lifestyle, and overall well-being, where she combines evidence-based knowledge with clear communication to educate and inspire diverse audiences. Beyond her professional pursuits, Eniola enjoys listening to podcasts, reading widely, and exploring new places. With applause and joy in our hearts, let's bring on board our speaker for tonight, Nurse Oyedeji Eniola. Over to you. Let me have you on the stage now.
Hi. Good evening. Hi, Nurse Omole. Good evening. Hi everyone. I hope you can hear me fine. Good evening, good evening, good evening. It's such a pleasure to be here. So I am like Nos Omolei has already said, I am Oyedeji Eniola Esther, and I am a registered nurse, a registered midwife. I hold a bachelor's degree in nursing and master's in view and PhD, who knows? So it's such a pleasure to be here talking on this topic. It's interesting how this conversation came about because myself and Omolengi were just talking randomly one day, and she's like, "Oh, Annie, how about I have you on my YouTube?" And I'm like, "Excuse me," and she's like, "Yes, why not?" And she said, "Okay, what would you like to talk about?" And I said, "Oh, how about we talk about PCOS, which is polycystic ovarian syndrome." But then she's like, "Oh, I already have that on my channel. I already have a discussion on that on my channel, and I would want us to do something new. So if you need more information on that, you can later or not now after the video check it out." But yes, so I was like, okay, I want to do something on women's reproductive health, right? So how about we talk on fibroid? And she's like, "Oh, that's nice, that's nice. It's a very interesting topic that has been on the increase lately, and a lot of persons just need to know more about this topic." And here we are today, and it's actually happening. So thank you, Nurse Omolei, for the opportunity. I am grateful. And I am happy to be sharing this I'm happy to be sharing this topic with you all. So the topic we have before us today is understanding fibroid, and not just understanding fibroid. Nurse Omole, you can help me with the slides now. So, what is fibroid? Fibroid. We hear a lot about this topic. Some know, some do not. Some have heard it. Some just know about it on the surface level. Some know about it deeper. Some may not even have heard it before. So, whichever category you fall into, we are here for you today, or I am here for you today. So, understanding fibroid. When the uterus become a host it never chooses. When the uterus become a host it never chooses. So yeah, that is just something to think about. So going forward, fibroid has is a health condition that has actually existed for a very very long time. So yeah, it's not just a new age. There are some conditions that just recently became prominent, so to say. But no, it has existed since far back as the 80s, the 1480s, the Hippocrates era. So Hippocrates actually discovered this, and then they just used to call it a uterine tumor. Then it didn't have the name fibroid then, so just they just thought of it as a mass, right, in the uterine walls. But then with advent of science and more research, we've gotten more information on this condition, and we've come about the name called fibroid. There's been a lot of new innovations, there have been treatments, there have been a whole lot on this, and we'll discuss a few of these amongst what we can cover this night. So moving forward, our agenda for today, we'll be talking on the introduction, the definition, the anatomy. We'll be looking at the anatomy. We'll also be looking at the causes, risk factors for fibroids. We'll be looking at the signs and symptoms. We'll be looking at the treatment options and management, and conclusion conclusion here. So moving forward, to introduce this topic, like I already said, fibroid is something that has dated back as far back as the 80s. So it's not a new medical condition, but of late it's been on the increase. Before it was like a one of 1 in 10, 1 in 20, but not anymore. So in our world today, fibroid is now known as a common benign tumor, and it affects women of reproductive ages, which is about 70 to 80%, and this is usually before the age of 50. So the global health metrics in 2021 estimated about 120 million people globally, that is women globally, live with uterine fibroid. 120 million. Can you imagine? Can you just imagine? Like, that is a very large number, and that is as at 2021. Recently, there have been no recent research done as at 2025 to confirm this number. But if as at 2021 we have this number, then you can imagine the value as at now in year 2025. But then, despite how high the value of this condition is, there are so many women that do not discover about this condition until when it's much later, because so people term it as a silent condition, because it could just be there, but you might not know until being diagnosed, right? That is why we're here today. So going forward, we'll talk about some things that can help you to identify this condition beforehand. So what are fibroids? Fibroids are also known as laying myomas. Sorry, laying myomas. So this is the scientific name, and they are non-cancerous growths that develop in or around the uterus. So one point to note is that they are non-cancerous. They are a growth, yes, but not cancerous. And they grow in or around the uterus. Going further, I'll explain what the uterus is in details. So this fibroid can be as small as a pea. We all know what is a pea, just very tiny like this, or it could be as large as a watermelon. So imagine the size of a watermelon in comparison to a pea. Mm-mm. So yes, fibers can grow as large as a watermelon, or they could be as small as a pea, and they vary from person to person. So it could occur as a single nodule, because it's, like I already said, it occurs in small tiny balls called nodules. Scientifically they are called nodules, but it occurs as small tiny balls. So these small tiny balls could occur in clusters. So imagine 1, 2, 3, 4, 5, 6, 7 of these small tiny balls, and coming together to form something as large as a watermelon. So yes, this is what this condition can do. And like I already said, they are non-cancerous, and in most cases they do not turn to cancer. So that is just a brief detail on what fibroid is. Also, fibroid occurs in different types. So there is from the diagram here, we can see on the left there is the normal uterus, and on the right there is the uterus that's a fibrous uterus on the right. So the types of cancer, there is intramural fibroid. So intramural fibroid is the most common type of fibroid, and it occurs on the muscular walls of the uterus. The intramural fibroid occurs in the muscular wall, and they are embedded deep. In this image, the fibroid at the lower left corner is the intramural fibroid. It just finds a way and just settles deep in the uterine walls, and just, I don't know, stay there, have fun there. Another type of fibroid is the submucosal fibroid. So this submucosal fibroid grows underneath the surface of the uterine walls. So we can see it at also the upper left corner. It just attaches itself to the uterus and grows there. Before we go further, there's something I should mention. Because fibroid is a growth that is not supposed to be where it is. So what it does, it takes advantages of the blood vessels around the location where it's at, which is the uterus. So normally the uterus has its blood vessels, it has its rich supply of blood and everything. But when this fibroid hitch itself somewhere, the muscular walls, the uterine walls, whichever place it is located, it attaches itself to the blood vessels, thereby enjoying the supply of blood there, because it is an unwanted visitor. It is not supposed to be there, and it just has to find a way to feed. So from there, that's how the fibroid tends to grow. It receives nutrients from the blood. It receives nutrients from the blood, oxygen, and everything. So that is its own form of nourishment, and the fibroid ends up growing in size. So this fibroid cannot exist without being attached somewhere within the uterine walls. Once it is detached, it dies off. Basically, that is how it operates. So back to the type. I already explained intramural fibroid, the submucosal fibroid. There's also the subserosal fibroid, which grows underneath the surface of the uterus. So on the right, we can see this very big looking mass. So it grows on the underneath the surface of the uterus, and it can grow quite large. So this subserosal fibroid is the category of fibroid that can grow as large as a watermelon because of its positioning, and it can extend even lower into the pelvis. So it is like the most fast and large growing form of fibroid, the subserosal fibroid. And we have the pendiculated fibroid. So the pendiculated fibroid, it attaches itself, excuse me, to the upper wall of the pelvis. You can see it hanging up just at the top. So that is the pendiculated fibroid, and it also has the name as when a pendulum, something that just attaches itself, it hangs on top, and it has the name of a mushroom-like structure because it looks like a mushroom. You know how the mushroom is shaped? The top is round and it extends down. So the pendiculated fibroid is also known as the mushroom-like fibroid. So that is all on the types of fibroid. So we'll be moving further to the anatomy and the physiology. So the anatomy of the uterus is made up of three parts, which is the fundus, the top parts, the body, which is the uterus itself, the middle part, and the cervix, which is the thin-like lower portion. And it is of three layers: the endometrium, the inner layer, the myometrium, the middle layer, and the perimetrium, which is the outer layer. So these are the three layers of the uterus. And the physiologic function of this is for reproduction, for pregnancy, childbirth, menstruation. We know that the uterus is the powerhouse of the reproductive system of the body. It has the it has the ovaries, which lead to the fallopian tube, and from the fallopian tube into the uterus, down to the cervix and outside of the body. So in childbirth, the uterus, no, let's even start from reproduction. So the ovaries releases egg, which passes through the fallopian tube into the uterus. So when there is when that is how menstruation occurs. When the egg is not fertilized, it sheds off and it comes out as menstruation. But when sexual intercourse occurs and the egg is fertilized, this egg attaches itself to the uterine wall, and it grows, and that is how childbirth occurs. Then I mentioned pregnancy, reproduction, childbirth, and menstruation. Yes, so these are the four major functions. So you can tell how important this uterus is. So if for any reason there is an abnormality in this uterus, it is already a problem because this can affect any of these four functions, and we don't want that, right? So this is just a brief surface of the anatomy and physiology of the uterus. So moving forward, we'll be looking at the causes and risk factors of fibroid. Okay, fibroid. What exactly causes this condition? So the exact cause of fibroid for now, based on research, is unknown. So we have not been able to pinpoint the cause of fibroid, but they can be linked to estrogen and progesterone hormones and genetics. So estrogen and progesterone are two hormones that are present in the female body, in the human body. And during reproductive ages, when there is an increase, a surge in these hormones, because fibroid is a opportunistic, like I already mentioned, opportunistic condition, it takes advantage of that. So these hormones actually fuel the fibroid growth. So when there is an increase in the estrogen and progesterone in a female body, there is a probability of fibroid happening. Then also genetics. It has been it has been researched scientifically that women of African descent, unfortunately, right, um, black women, Africans are of higher chances of coming down with fibroids. We don't know why, but that is what research has told us. So estrogen and progesterone and genetics, these two things have been linked to be a cause of this condition. So now some risk factors that can also precipitate having fibroid. We have obesity, high body mass index, that is high BMI. So a person that is obese has a very high chance of coming down with fibroid, because in obesity there is higher fat mass than the body requires. So the fibroid, the growth can take an advantage of that and lynch on that to increase in size. So there is family history of fibroid, like I already said, genetics. So a person that has um, a relative or somebody in the family, mother, grandmother, sister, with this condition has a higher chance of coming down with it. Though it is not a must, but then there is a higher chance of coming down with this condition. Then late menopause. I'm going to explain late menopause and early onset of menstruation together. So, late menopause. Menopause is the cessation of menstruation in a woman or in a female. So, when menopause occurs, there is no more release of egg, there is no more shedding, there is no more menstruation, basically. But when this happens late, it can precipitate fibroid. How? Because there is a longer time, because the hormones estrogen and progesterone also play a role in menstruation, right? So when there is a longer time these hormones are present, it gives more room for fibroid to occur. Early onset of menstruation, which means when a female or a woman starts her menstruation cycle on time, early. And there is the length of time from menstruation up until menopause. So this length of time gives the fibroid enough time to grow and to grow. So late menopause and early onset of menstruation are two factors that can precipitate fibroid. Then nulliparity. This is quite interesting because you might ask the question why. Nulliparity is a term for a woman that has not given birth. A woman that has not given birth, of reproductive age that has not given birth. So you wonder, the fact that I've not given birth, why is it supposed to precipitate fibroid, right? But it has been proven by research that women of this age, because, like I already mentioned, the presence of estrogen and progesterone is there and is quite high, and in quotes, nothing is being done about it, it can precipitate the formation of fibroids. So those are some causes and risk factors of this condition. So moving forward, I'll be talking about the signs and some signs and symptoms that can help to identify this condition. So we have heavy bleeding. So as a female, if you notice that when your menstrual cycle is on, the bleeding is quite heavy. Yes, there'll be bleeding, right? But there is heavier bleeding. There are some people that talk about how in a day the number of sanitary towels they have to switch is a lot. That tells you something, right? The bleeding is just, and sometimes this bleeding comes out as clots, not just as the normal flow. It might come out as clots. So this is another um symptom. It might be a symptom of uterine fibroid. Also pain. Some people experience severe pain. I don't know if you've heard of people, you have friends, yourself, you experience some kind of excruciating pain during your menstrual cycle, during your period. Some people have to be on admission in the hospital giving extreme painkillers. We know that, okay, for some of us in the healthline, we know that painkillers have level. There's level one, there's step two, there. For this for just menstruation is not just, sorry to say, but like for a condition as menstruation, some people have to receive level 3 of painkiller, of opioid analgesic. You know how severe such a pain must be. So if for such people that experience heavy bleeding, and mind you, if you experience 3 or more of these symptoms, not necessarily saying that you have this condition, but it is very, very important to get yourself checked. Going forward, we'll talk about that. So severe heavy bleeding, severe pain, So pelvic pressure, so at the lower side of your abdomen as a female, if you experience some kind of pain, like as if something is weighing down, pushing down your bladder, this might also be a sign of fibroid. Also frequent urination, because like I mentioned, there are masses, and the bladder is also located within, around the reproductive system. So this mass can weigh down, press on the bladder, which leads to frequent urination. So you notice that the person tends to feels the urge to urinate frequently, and some, even before, let's say, the bladder gets to its maximum capacity, the person is already feeling the urge, so the person tends to go in and out of the bathroom frequently. That is also a sign. Difficulty in getting pregnant, like I mentioned in the anatomy and physiology, how the uterus plays a vital role in reproduction. So when there is a mass or anything that prevents the implantation or fertilization of the egg, such a person might experience difficulties in getting pregnant. The fibroid, like I mentioned, it is opportunistic, so it finds a way of niching itself and taking the, so to say, favorite parts of the uterus. And when that is present, the fertilized egg cannot implant, and reproduction cannot go on. So lower back pain, some people experience back pain, some people experience constipation, which is also relating to the organs and system in the body. And the most common sign that is most popular is abdominal distension. That is the one that everybody knows. So as it grows bigger, there is extension of the stomach, and some people will say, oh, it looks like a 2 month old pregnancy, 3 months old pregnancy. So yes, fibroid can lead to abdominal distension too. So now we've talked about the causes, risk factors, we've looked at some signs and symptoms. So now let's talk about treatment options and management. But before this, how can this be diagnosed? First of all, talking about the signs and symptoms, if you or anybody you know experience any of these signs and symptoms, the first thing is to present to a hospital. Upon presentation, you see a doctor, explain how you feel, the signs and symptoms. Some diagnostic tests to be prescribed, some scans, and so on and so forth. So when these scans are prescribed, this is a confirmatory test. So the signs and symptoms only point you towards it, but do not confirm it. Mind you, do not think that, oh, since you experience any of these things, automatically you have fibroid. No, they are only a pointer, or the person has fibroid, sorry. They are only a pointer to the possibility. So upon going to the hospital, diagnostic test is taken, samples, and so on and so forth. So so on and so forth. So that now confirms the condition fibroid. So now let's look at the treatment and management option. So for treatment and management of this condition, it involves various forms, various things, from lifestyle modifications to medications to treatment to surgery rather. And this depends on the size of the fibroid, the location, the severity, the person's age, health condition. Like some people have associated health conditions, right? So these four things should be considered before any of these treatment options can be recommended for such a person. So the size of the fibroid, the number, the location, yes, and the severity. So the first treatment option we'll be looking at is lifestyle modification. So if you remember, I mentioned obesity as one of the risk factors that can precipitate this. So for an individual that is obese, the person has to have lifestyle modification. So the person is encouraged to be active, exercise more, burn off this excess fat, and so on and so forth. So lifestyle modification is the very first thing. Also the food being eaten. There are some food that fibroid is stingy. Yes, very stingy. There are some food that can increase a person's chance of. There are some food that are high in estrogen and progesterone, right? Some food like nuts, legumes, and so on and so forth are really high in estrogen and progesterone. So for an individual that has experienced these symptoms or probably already been diagnosed, you know that, oh, such foods should not be taken so as not to increase the risk of the growth, right? Then also, okay, something else I forgot to mention, so let me just add it now. Fibroid can be in two form, which is symptomatic and non-symptomatic. Excuse me, symptomatic and unsymptomatic. So for symptomatic fibroids, the person experiences three or more of the symptoms I already mentioned. But in unsymptomatic fibroid, the fibroids are there present, but this person may never know until the person attempts giving birth, that's childbirth, or something, whatever takes such a person to the hospital, and scans are run, and that's when they discover that, oh, there are fibroids present in the uterus. So some people might even have fibroids and do not know. So for those that have asymptomatic fibroid, there is really nothing to worry about, because it means that it is not affecting the reproductive function. It's not affecting anything in the body. But those with symptomatic fibroid, it has to be attended to as soon as possible, because the fact that those symptoms are already showing means that it is affecting one or more things in the reproductive system. So let's note that there are two types: symptomatic and unsymptomatic. So unsymptomatic, the person do not even experience none of these um symptoms. The person just lives freely, thankfully. Then symptomatic experiences one or more of those symptoms. So as I was explaining some management and treatment options, I mentioned lifestyle modification. Also, medication such as OTC. OTC is over the counter pain medications like paracetamol. Um, those medications help with pain. Some might have to be prescribed higher pain medication. Sorry. So also iron supplements, because fibroid is a condition associated with bleeding, most times heavy bleeding. Women that have this condition have to be prescribed iron supplements to replace the blood loss that is going on, the red blood cell, to help with regeneration and so on. So iron supplements such as fesolate, tab fesolate might be prescribed. Also, for those that have experienced heavy bleeding, tranexamic acid may also be prescribed to help um, improve, or to help the red blood cell regenerate more blood cells. um yes, so iron supplements and birth control pills in some cases. So now birth control pills are not being prescribed for birth control though. Let me explain. So why birth control pills are prescribed is that they contain a level, the birth control pills help to regulate the estrogen and progesterone present. So they contain estrogen and progesterone in various forms. Some contain more of progesterone, less of estrogen. Some contain in the same level. Some are just progesterone without estrogen. So these pills can be used to regulate the amount of estrogen and progesterone in the body. So this, by doing this, like I mentioned, estrogen and progesterone is a risk factor, right? So by doing this, it helps to stabilize the woman's hormone system, right? To help the body be on a safe level, because too much of everything is bad, despite the fact that it's the body that produces this estrogen and progesterone. Too much of it can lead to something negative, like in this case fibroids. So those are for medications. Then there's another medication that I would like to add. That is the gonadotrophin releasing hormone antagonist. Gonadotropin releasing hormone antagonist. So this also functions like the birth control pills by helping to regulate the amount of hormone present, the gonadotropin hormone present. helping to balance the hormonal level of the woman. So going further to the more higher or more serious this thing, like I mentioned, depending on the case or the depending on the kind of fibroid, basically, that is what is going to determine the treatment option. So we've looked at lifestyle modification, medication. So now looking at fibroid surgery. So myomectomy. Myomectomy is just the surgical term for the removal of the fibroid. So that is a surgical operation that can be done for fibroid. So hysterectomy. Hysterectomy is done when the fibroid is already too large. When it is already serious, it has embedded itself in various places in the uterus that the uterus cannot be saved anymore. So hysterectomy is done, which is the total removal. It is really sad because when this is done, the woman basically do not have a womb anymore, which is what the uterus is called. But then it is done in women that are over childbearing age. So to say, it's like okay, they are past childbearing age, so I don't want to use the word they don't need it, but like it doesn't affect any function if it is being removed. So also uterine fibroid embolization, that is a surgical, it is a very little invasive procedure. It is very little invasive. Though it is not yet so popular in Nigeria, hopefully we get to know more about it down here. But it is done using high lead, high technology cameras. It is just the camera is inserted into the uterine wall, and a very little um, machine is used to make the um, incision, right? A very little machine is used to make the incision to remove the fibroid. And lastly, we have radio frequency ablation. Radio frequency ablation. This radio frequency ablation is done for smaller fibroids. So it is not done for fibroids that are as large as a watermelon. No. It can be done for pea size, excuse me, pea sized fibroid. So that is all on the treatment options and management. Going forward, we'll be, okay. So going forward, we'll be looking at the conclusion. So with this, I hope we've learned something, one or two or more, a million, 1,000, who knows? But I just hope we've learned something on this condition. So that's fibroid, despite being very common, is not life threatening, opposed to the general notion out there as people think. It is non-cancerous. It is a growth, yes, but it is non-cancerous. It is not life-threatening. Early diagnosis, early treatment, early management helps improve the prognosis and improve the person's quality of life. So if you ever notice any of these symptoms, please do not ignore. Please always try to seek prompt medical advice. We all know that our health is wealth. True or false? True. I'm not leaving you to answer that. Health is wealth. So we should ensure that anytime we see any abnormality, especially anything relating to the uterine system, the reproductive system rather, please take it seriously and not with levity. Fibroid, common, silent, but not unbeatable. So yes, it is common, it is silent, but it's not unbeatable. We can win against fibroid with all of these things I have mentioned. I hope you learned something tonight. I hope you had such a nice time listening to the little things I had to share on this condition. Please, if you have questions, make sure to ask your questions. You can type in the comments section your questions and I would answer. Thank you. Over to you, Nurse Omole.
Thank you so much. We can all agree that that was quite amazing. As in, I was just clapping for this because there's too much knowledge. You know, when someone knows book too much,
Ah,
that's how it always like. I was just like too much knowledge. You know,
mm,
I forgot to mention this when I started with like my speech tonight. We didn't
mm,
plan this session. In fact, I can say that this session was one of the unplanned one that I've had in a very long period of time. I just
mm,
met Annie at one, don't let me expose our secrets of where we got ourselves that day. And then, I was just saying, oh, I need someone to come up and teach. And then she was like, okay, I said, let's talk about anything reproductive issue. And she just like was bringing up different topics. And then she said, fibroid. I said, "Yeah, that fibroid is very good because it's something that is very common among women of reproductive
Mm,
ages. And sometimes if you would hear that young people, well, that's why it's called reproductive ages, because it does not mean that they have to be 40 something before fibroids can happen. You hear people that are maybe 20 something, 30 something having
mm,
fibroids. So I was just like, this topic is one for the books. Like we have to talk about this. And I've been so busy, but the fact that Nurse Oyedeji just I don't know the English to use. I mean, when you just know that this person will just deliver. Oh my God. Can we all just say thank you so much? I don't even know the English to use again, but thank you so much, Nurse. I was just like, oh my God, wow,
mm,
wow. Ultra, I was just saying, wow. Like that was a very, very amazing session. I learned a lot. The part that you mentioned that fibroid like they are opportunistic, that they tend to attach the blood vessels. That's how they get there. I was like, hey, too much knowledge. Even I didn't know that. I just know that fibroids do grow. I didn't know that that was their main secret. That so
that
it means
is
that the
it.
moment they are cut off, that's why. So when you
Mm,
mentioned it kind of made more sense to me that the moment they remove them, that's why they can't grow anymore, because they've cut them off the main. I was just like, knowledge.
exactly.
I just kept on clapping. That was so enlightening. I said, God, hey, no, sorry, did you went to prepare for us? Like, thank you so much. That was so amazing. That was so amazing. Thank you so
Mm,
much. But before we let you go tonight, I have a
welcome.
question that someone asked on my phone, and I'd love you to respond to that. And if you have
Okay.
any question as well, please, can you just send it in so that we can respond to it together? Okay, so the question says, do you believe that a woman who has fibroids can take apps? Do you believe herbal medications work for fibroids? Hmm.
Mm,
Hmm.
deep.
Very deep. That's the question I
Deep.
got here. It says, do you believe
Okay.
herbal medication works for fibroids?
So do I go on?
Yes, you can. You can answer that.
Okay. So do I believe herbal medication work for fibroid? So first of all, let me first clarify that it depends on what the person mean by herbal medication, right? I don't know if the person is referring to concussion that they have gone to go and mix somewhere. Mm-mm, mm-mm. But then um it is important to note that medications, even the medications we take, the processed medication that looks so tiny, that has been made into pills, are herbal medication, are herbs. They are gotten from one or two herbs somewhere. Our pharmacists can confirm this. They are gotten from one or two herbs somewhere before being compounded and formed into a drug, right? So, um, so drugs are also made from herbs. So notwithstanding, do I think herbal medications can also be a form of cure for treatment? It's a form of treatment for fibroid. Yes, but let me explain. Yes, in the sense that, like I already explained, some of these drugs, there are some drugs that have been, um, I've heard of herbal tea, like a all this kind of green tea. So a form of tea that helps alleviate the symptom. Now, when some women drink, it helps with the heavy bleeding, with the pain, and so on and so forth. That is a form of herbal medication. As a cure, I cannot confirm that as a cure. I can confirm that it helps to manage symptoms, yes, but I cannot confirm that as a cure. So yes, I would say that it helps with the management of fibroid. I hope I answered that question.
Yeah, actually, I think you
Okay.
answered that, because even
Okay.
if the herbal medication actually like works for the cure, I mean works for the symptoms,
Mm,
it cannot. I also don't want to agree that maybe it can cure it completely, since
mm,
even if the herbal medication works to maybe reduce the symptoms, as long as the fibroids are still attached to the blood vessels where they are getting their nourishment
mm,
from, I
mm.
just think it's kind of hard for it to just eradicate it completely. It can suppress the
Yeah.
symptoms. There might not be pain or
Mm,
bleeding and all, but as long as those things are still there, especially if it's like a watermelon size kind of, fibroids. I honestly do not think that
Mm,
the herbal medication can do that as well. All right, thank you so much, Nurse Oyedeji. I hope that answers your question about medication. There are some medications that we use to, they're gotten from herbs, and I've seen people that would say they
yeah,
mix, not the ones of ginger and, I mean, not the ones of origin and Chelsea and all those things. Though those ones that they are
yeah,
not herbs. Though.
exactly,
I mean, like the herbs from the
exactly.
grass, the grassroot of the herbs, the real
Yeah,
one. Yeah, I know that
like
some of them.
we know how ginger helps with bloating, so
Yeah,
those are help.
yeah. Yeah, because all those green tea as well. I used to be on the
Mm,
lookout for them because I love anything
mm,
about, so anything about that will just
mm,
make me feel like, okay, I'm going back to the grassroots. Before these medications came about, our
yeah,
background, people were taking apps and they were doing well. So
yeah,
I would not
yeah,
really say that we should eradicate that, but at the same time, it cannot, take it away completely, but it can work for the symptoms.
mm,
Thank you so much, Nurse
true.
Davis. Another question
You're
here from
welcome.
another question
Okay.
says, I have a question though. I think I missed the
Mm,
part you mentioned about nulliparity. How
mm.
exactly is nulliparity a risk factor for fibroid?
Oh, okay. How is nulliparity a risk factor? Okay,
I
a
think the
risk
person is
factor.
saying because nulliparity means, they've not given birth, that kind of thing. So how
Mm,
how is it a risk factor for fibroid?
okay, so let me explain that. So it is interesting to note that, like I mentioned, this fibroid is quite opportunistic, right? And I mentioned that the hormones estrogen and progesterone are the risk factors that cause this condition. So a woman that has not given birth in her reproductive age have these hormones present in some persons in a high proportion. Do you understand? So these hormones are present in a high proportion, and these hormones in turn can lead to the formation of fibroid. So now the uterus is just there, it is available, right? In quotes, it is available, right? And these hormones are there present, which now in turns lead to the growth. And this growth now attaches itself in the uterus. At least in a woman that is already pregnant, whether the hormones are present, the fibroid cannot form. I don't know if I'm communicating clearly. So when these hormones are present in a woman in reproductive age, it can lead to the formation of fibroid as long as the woman is in reproductive age. And there are a lot of women in reproductive age that are not yet married, that have not yet started childbirth, but have been diagnosed with fibroid. Recently, sorry, let me share this example. Recently, let's say a month or two back, I nursed a patient, and she's just about 22 to 23 years old, and she was also diagnosed with fibroid. Hers was even symptomatic. You can imagine, 22, 23. So she's not married, she has not given birth, but because she's already in reproductive age, the estrogen and progesterone are present, and in her case, in a high level, which has led to the formation of fibroid. So she had to undergo surgery. We nursed and took care of her, and to the glory of God, she's doing very well right now. So that is how nulliparity can be a risk factor to fibroid. Thank you. Excuse me.
All right, thank you so much, Nurse Daisy, for answering that. And I hope that the question was well answered to the person that asked the question. And when you were speaking, I just kind of thought about something that I think is kind of, I would not say selfish, but I think is unfair. Because you know that you mentioned the risk factors for fibroid. You talked about obesity. So let's say that someone is naturally obese, like they have normal BMI, they are not obese or fat or anything like that. And
Mm,
maybe
mm,
genetically as well, there is no one like that has that kind of thing in their family. So, like,
mm,
my point is, what is causing the rise in estrogen and progesterone? I think we need to look into that because somehow I'm like, the major culprit now are the hormones.
mm.
The hormones, like the moment they're high,
Very true.
all
Very
those things
true.
can happen.
Very true.
But then I'm like, other factors that you mentioned, the obesity part, that one can be controlled. The genetics
Mm,
part, that one might not really be
mm,
controlled. You know, you cannot really control that sometimes. But then I'm like, is there a way that I don't want to say is there a way we can monitor the estrogen levels, but is there a way that how do I put it in English? Like what can be done to like maybe reduce the estrogen levels? I mean, I
mm.
don't know if that question actually
It's,
speaks well, but
yeah, I
sometimes I'm like,
understand.
how can we know? Yeah.
Mm. It's funny how I was reading something recently, and um I don't know if we'll call it evolution, how everything is changing, but there's been a rise in, like, like you said, estrogen and progesterone level. Number one, there have been a lot of, like, now, before young girls get their period back in the days, like, oh, 13, 14, there about, maybe even 15 for some people, maybe 13, 14 ish. But now, like, as early as 9, 10, young girls already get seeing their period, starting their menstrual cycle. And some of the like, what I was reading, the person was just talking about that, why is it that way? And the person made mention of how even what we eat now contributes to that. The diet of now compared to then has really, really changed. So unlike then, where everybody was eating clean, so healthy, and like I also mentioned, evolution cannot be controlled. Man in of the stone age is not man of the present age. So the person also attributed to the fact that evolution is happening, right? There is change in the body, genes and generation. That is why um, people are having early cycles, increase in estrogen and progesterone, and also attributed it to, like, our diets now, what we eat now in comparison to before, how there is like a very huge change. So these are the two things that I can actively say on that, on your question, Nasamole.
All right, thank you. You know, if I keep on thinking deep, we will not live here because different things are just coming to my head. Like, this is such
Mm,
a very, very interesting topic. I'm just like,
yeah.
all right, thank you for that. Like, you explained that perfectly as well. That evolution, things have changed, things are changing, things will always change. I think that's just how life is, basically. And you know, you also mentioned diet. So I think
Yeah.
one assignment, I would not really say assignment, but I think one thing that I would encourage females or women to do is watch out for foods or diets that can actually increase the
Increase.
hormones as well. You know, like stress. Whenever we are stressed, I'm taking stress as an
Mm,
example. You know, like whenever we are stressed as
yeah.
humans, the hormone cortisol is released, and that can
Mm,
also interfere with the hormone regulation in a woman. You know, some people can say they got their menstruation late and all. But my
mm,
point is, something made it change. Something made something happen because you
mm,
were severely stressed. It
mm,
interfered with the normal balance of hormones in the body, which means that
mm.
we also need to pay attention to our body. You know that you
Yeah.
mentioned something earlier that fibroid is not unbeatable, right?
Yeah.
And that nothing just happens. That's one thing I believe personally. Nothing just happens. For example, you're experiencing headache consistently for 4 days. That is a warning sign. Don't say it's nothing. I just like a minor
Mm,
headache. That's not a minor headache,
mm,
because a minor headache should happen once and then you move on. After you've slept or taken paracetamol, you move on. But when you begin to experience something consistently, that is like a warning sign. So I
mm,
feel like the body always gives a warning sign before it strikes. So the moment we begin to experience different things. You know, we might be
yeah.
feeling pain around the pelvic region, and you're just like, oh, it's just a normal pelvic pain once I sleep. But I think the most important thing or takeaway that you have to take home
Mm,
tonight is pay attention to your body. Know when the pain is not the normal pain that you used to feel. Know when the menstrual flow is
true.
heavier than normal. Know when you feel what you were not feeling
Mm,
before. And the moment you begin to experience all these things,
mm,
it's best you just get yourself tested. You know, sometimes we just tell ourselves, oh, it's expensive. I don't want to go to the hospital.
mm,
It's expensive, it's stressful. But I think I would take the expensive and stressful than nursing something that could have been avoided. So please, it's just very
mm,
important that we pay attention to ourselves. Pay attention because we are women, and God created us in the best form and best image. And I don't want to
Mm,
go into religion, but God created our body to function perfectly and normally. But there are some times
mm,
that we humans as well, we just need to pay attention to whatever is going on in our body, and get ourselves treated as soon as possible. And I just pray for every female and woman listening to me tonight that your body would operate in the way that God has created it to function. And I pray for
mm,
anyone going through anything in their body. I pray that the healing power of God is upon your life, and that your
mm,
cells, your organs, your tissues, and every part of your body restores to the normal functioning in Jesus' name. God wants us
mm,
to be whole and healthy. God wants everyone to be whole and healthy. So please, in as much as some things cannot be avoided because of how it is, it's very important that we also pay attention to whatever goes on in our body. Thank you so much, Nurse Oyedeji. In fact, I've learned a lot. And if you just let us be, I'll just keep bringing up questions and we'll just keep on talking. This is one of the most insightful, interactive, engaging, enlightening one that I've had in a very long period of time. Thank you so much once again for coming on
thank
board. I learned
you.
a lot. Thank you so
Thank you
much.
for
And I
having
myself, I've learned a lot. I've just learned a lot. So before we go real quick, can we, those that are still active, can you give us like a short summary of what Nurse Oyedeji said? She talked about what fibroids are, that fibroids
me.
are non-cancerous, right? So it's not like it's a cancer. They are non-cancerous. It's just that
Mm,
even if they are not cancerous, we just don't want them in the body because they are not meant to be there. It's like
mm,
unwanted guest. So we just do not want them there. That's why they have to be removed or dealt with or treated as soon as possible. So she also
mm,
mentioned the various places where fibroids can grow. And what is the major organ that fibroids attack? Anybody that gets it, I'll send 1 million naira to your account right now. Try me. Try me. What is the major organ that fibroids attack? Anyone wants to give us the answer? What is the major organ that fibroids attack? And she also mentioned places that yes, thank you. The uterus. Thank
yeah.
you. Ah, yes, yes,
Last
yes. Uterus. Yes. So she also mentioned places that the fibroids can attach to in the uterus. She also mentioned places. Does anyone want to tell us that? She mentioned, even if it's two, you can remember. She mentioned some places that the fibroids can attach to in the uterus. She mentioned places. We know it's inside the uterus, but I know she mentioned places. So anybody wants to bail us out with that? She mentioned places that it can be attached to, and the major signs and symptoms, the warning signs and symptoms that you would
mm,
see as well. She mentioned the bloating, the pressure, or the pelvic pain or pressure, heavy bleeding. Yes, there are opportunities, but she also mentioned some specific places that they can attach to in the uterus. Something serosa.
this big
Also
English.
mentioned some places. Yeah. I said something serosa to give you hints.
Mm.
Okay. Okay,
Ọmọlá
yes.
Ọmọlọ́lá Fákáyọ̀dé.
Did she get it?
Yeah, she said muscle, the muscular, muscle,
Okay,
close.
okay,
Yeah, and the subserosa.
okay. All right, thank you. And then the major warning signs, she mentioned that, and also the what was it called? I mean, the risk factors as well. Progesterone and
Yeah.
estrogen, obesity, genetics, so many things can also be a cause. But the most important thing is please pay attention to your body and know when to take yourself to the hospital and get treated. And I pray for everyone again. I just pray for you that your body will function the way that God has created it to in Jesus' name. And none of us
Mm,
shall be a victim of sickness and illness in Jesus' name. Thank you so much
mm.
once again for being here tonight. This is, oh my God, I don't feel like going, but we have to go. This is so
It's
amazing.
okay.
Such an
I agree.
enlightening session, right? No, Seniola. No, so you did, you
I,
pardon me.
I agree. I agree. It was so
As in,
nice.
we're just flowing. It just came natural. Thank you so much once again. It's such an
Thank you
honor
for
to have
having
you.
me. Thank you for having me.
Thank you
Thank
so much. Thank you. And please don't forget to subscribe. If you've not subscribed right
you.
now, or yeah, click on the red
Oh,
button and
yeah.
subscribe and be a part of Health Up with Kemi family. I've made over 100 videos in the last few years. You can just go through them and learn from each of the videos. And like I said, that the month of September was for PCOS and sickle cell awareness. So I made videos on PCOS, polycystic ovary syndrome, that it also affects women, and I also made a video on sickle cell disease. You can just go through the page and learn from these videos as well. Thank you so much once again. I look forward to having you on board another time for another amazing session. Thank you. No, so Ideji, is there any final word to our audience? Any final words or
I
message to
want
our
to say
audience?
thank you for listening. I could see the comments. It was very interactive. It showed that you guys were following, and I don't know. It was such a nice time. I enjoyed doing this, and I just want to say thank you to all. I can see them, my friends, and it was really nice. It was really nice. Thank you for having me, Nosumole. I don't know. It's your platform. I wouldn't have done this if you didn't give me the platform. So yeah,
Thank you for
thank
coming on board. I just don't want to say all the story. We had, she would say, I don't know. And then I'll push her again and say, you can do it. Just come up, come up. Thank you so much. I just knew that you were going to, bring it out for us. Thank you so much, everyone. For those that stay on the call,
you.
Ololafa Kayode, Dorcas
Yeah.
Mosi, Precious. I can't pronounce your surname. I'm sorry. I don't want to spoil it, but thank you so much. God bless you all. Till we meet again another time. And happy new month in advance. Can we just say
Oh yeah,
happy new month, everyone?
happy new month in advance. It's Nigeria's
Yeah.
table. It's all right.
Happy new month in advance, everyone. We wish you the very best of the month. God bless you. God be with you. God uphold you. God strengthen you. God keep you, preserves you, and protects you in this month and for the rest of the year in Jesus' name. Thank you so much for being here. Enjoy the rest of your night. Thank you. Bye bye,
Bye.
everyone.
Bye bye.
Bye. Thank you. Bye. Good night, everyone. Thank you so much.